Hello and welcome to Insights in Action with Orange 142, where we interview agency leaders and business owners to uncover the journeys, the strategies, and the insights that drive their success. At Orange 142, we're all about transforming brand stories into impactful digital experiences through innovative media and marketing solutions. And today, I'm very lucky to be joined by Dr. Vikas Reddy of Summit Medical Consultants. How's it going, Doctor?
I'm good. I'm good. And thank you for having me.
Yes, thank you so much for being on. And Doc, I would love to just start this off by understanding a little bit more about your background and a little bit more about Summit Medical Consultants.
Sure. Yeah. My background is I trained in family medicine. Initially thought I was going to be in the primary care space and started off that way in outpatient medicine, transitioned into urgent care initially, but found out that I was living in a immediate gratification type of environment
Yeah.
with the patient panel that I was dealing with. So I was just looking for something more meaningful and met the owners of Summit Medical Consultants, started with them in a pivotal growth phase that they had and loved the vision of taking care of the vulnerable elderly population. So I started from the ground up, seeing patients initially, then transitioning into facility level medical directorships, then regional medical directorships with Summit itself, and then now vice president of clinical performance. Just grew within the company as we've grown over the last decade.
Yeah, wow. And so what motivated you specifically to specialize in post-acute and long-term care settings? And how has that focus shaped your approach to patient care?
Sure. Yeah, I was just looking for more like long-term solutions. As I mentioned, the primary care space seems to be more instant gratification, but in the long-term care SNF setting, it kind of transitions into what we call quality over quantity of life and long-term care solutions. And each kind of nugget's different. Each patient has different values of what they want from their healthcare. So understanding the person at a human or a philosophical level and gearing the care that we provide specifically to them. So it's more patient and goal directed.
Yeah, I love that. One of my first big boy jobs was working at my parents' care home, and I was doing the marketing for them, and I loved it so much. I loved hearing people's stories, the residents, their stories, and all that stuff. I'm sure you get a lot of that every day, right?
Right. Yeah. Some of these, it's can't even imagine the cool stories that they have, what they've
Yeah.
done in their lifetime, what they've gone through, especially in the climate that we're living right now, and really seeing their perspective on life and in a different environment.
Yeah. And so, speaking of patients, as a vice president of clinical performance and improvement at Summit Medical, what initiatives have you implemented to enhance the quality of care for geriatric patients?
Sure. So a lot of companies in general, healthcare is leaning towards a value care model. So it essentially means eliminating duplication of services. So we're looking at that. We've created like a care coordination team, essentially a group of our own nurses that we deploy to these nursing homes. That's a bridge between the nursing home and our providers. So whether it be Miss Sally went to see a specialist and we're not able to locate what they wanted or what their care plan is. So they'll help us out with that end. Also, if someone recently got lab work done, they'll help coordinate so we're not duplicating
Mm.
lab work or any diagnostic testing that there is. And also getting more information on what they want out of life as well. A lot of times as providers, we're busy, so sometimes we just go in and out. So this way it gives an opportunity for the patient to say, hey, I told Dr. X this. Now that I think about it, I don't know if I want to go through those procedures or want that type of care plan. So it gives us a better opportunity to truly hear what those patients are wanting and delivering on the care that they expect.
Yeah.
So one aspect. We're also working on like transitions of care from subacute to home. So we have like EMTs that meet with the patients before they discharge from like a rehab facility, and then they'll meet them at their home to ensure med reconciliation is accurate. If there's any DME supplies that were overlooked, we could help them through that and then take care of them for the first 29 days until they get to go see their primary care provider again.
Wow. I love that. And growing up, when I would shadow some of my family who were doctors, that was the one thing I picked up on really quick. It doesn't matter if they're geriatric patients or just regular everyday patients. Patients I notice very quickly just want to be truly heard.
Exactly, yeah. Uh,
Yeah. And okay, I want to make sure I'm saying this right. This might be an internal term. SNFist? Is that
Uh-huh.
what you guys call them?
Correct. Yeah, it's just a new terminology, probably started within the last decade as well, and
Mhm.
not as widely known as you're going through the educational process, but definitely something that there is a big need for more SNFist positions. So it includes the whole spectrum, post-hospital to pre-home, essentially. So for rehab, people that hospitalized but can't go directly home. They need some physical rehab. So we'll
Yeah.
take care of the medical side while they're undergoing rehabilitation services. Then downstream would go down to long-term care where they're actually primary care providers.
Mm.
And then if they go down to assisted living, they can choose to continue with their previous primary care provider, but we do provide services where we'll come to them to where they're residing and see them at those facilities, and then also the independent living facilities as well. So we'll
Yeah.
go to you.
So how have you seen the role of a SNFist impact patients while they're at home or wherever they may be like that? You said it's a new term. It seems like a more of a new position. What positive changes have you seen from that?
I think it's improved like the availability these days. If you do have acute condition and you want to see your primary care provider, but it might be weeks or a month to be able to see them. And then that essentially runs into like urgent care or the ER and then saturating that end. So this way we have availability. We partner MDs with nurse practitioners. So then we have anywhere from 3 to 5 days a week of coverage based on the amount of patient volumes we have per facility. So if someone's sick, someone might be there that same day within the facility or been seen within 24 hours. Closer monitoring, better understanding, or more opportunities to better understand what the patient's looking for, and then integrating with the facility because the facility also has a structure that they could operate under. They don't have all the resources like the hospital would, so we have to, I always call it kind of MacGyver patient care with the resources that we have.
Wow, that's awesome. And I'm glad that position exists now. Sounds like there's a real need for it.
Exactly. And hopefully people can get more awareness to that position and look into that. It's a subset of primary care, but definitely
Yeah.
an important one.
For sure. And so I know that education is a significant aspect of your work. And so I'm curious, how do you approach educating non-physician providers in post-acute long-term care settings to ensure consistent and high-quality patient care?
Sure. Yeah. So we have a kind of robust system that we have. So we have a back end team that they review notes from our non-physician providers.
Mm.
So look at the quality of notes compared to discharge summaries, make sure that we're documenting accurately what happened. So we'll educate them on that process. Then we'll look at our transfer data. And the majority of the time when we send someone out, they had to go back to the hospital. But then we kind of work backwards. What could we have done 3 days before, 5 days before to change the trajectory? Because even let's say the Titanic, if it changed trajectory by 2%, it would have never crashed. So we look at it from that theory of maybe there's something minute that we missed that we could have done differently. The other aspect, we do monthly meetings where we pick a topic. We keep track of the most common reasons for being hospitalized. So, for example, for whatever reason, for Q2s, it seems to be GI bleeds. So we'll look at all our patients, see what our bleeding risks are, discuss with patients about what the guidelines are in regards to prescribing either anticoagulants or antiplatelets, NSAIDs, and how to safely deprescribe those if appropriate, or how to protect the patient if they need all those medications.
Wow, that's really interesting. And I'm glad that you guys have such an emphasis on attention to detail because I know that's some part of your training, becoming a doctor is like extreme attention to detail. And it seems like you guys are really expanding that to all your staff to make sure that quality care is consistent.
Exactly, yeah, and especially we're unique and you have a partnering MD and a nurse practitioner or PA, and then they're following each other, so we had to make sure there's some sort of consistency in how we operate.
Yeah, for sure. So, with the increasing aging population, what advancements or changes do you anticipate in the field of geriatric medicine, particularly within nursing home settings?
Sure, I think there's a stronger focus on value-based care, so a lot of it is substituting medications. There might be all these new brand name medications that are coming out that patients might be on prior to entering the nursing home setting. So learning how to manage if a pharmacy says this is too expensive to continue to prescribe. But then also goes back down to what does the patient actually want? Do they
Yeah.
still want that type of care or not? Then also like the different resources provided in the hospitals, in the nursing home setting as well, whether it be more care coordination, do we need to create more wings of like PM&R, wound care, have like more palliative or hospice care that's within the organization itself. Because right now everything's fragmented. There might be a company that does wound care, a company that does hospice. They're trying to get that all integrated together. And also the care transitions too. A lot of times patients go to the hospital, they come back and they might not have the most accurate medication list, or they're confused, like, oh, I was on this before and now I was prescribed this. What do I continue? Uh,
Yeah.
a lot of that's going to change as well in how we tackle a lot of the operations and the schematics of it as opposed to like true patient care.
Yeah, and that's such a good thing. If yeah, I know the communication is a big issue or transfer, just like you're saying. So I think that just improving that will improve patients' lives so much.
No,
Yeah.
exactly. Yes. And hopefully we're able to do it, and hopefully we could try to be in the forefront of all these changes.
Yeah. And so reflecting on your career, what advice would you offer to medical professionals that are considering a focus on post-acute long-term care or becoming a SNFist?
Sure. So I compare it to utilizing all the knowledge you gathered during the educational part of your life. Most of the time we think, oh, I want to be a specialist, but you're just focusing either on this one organ system or want to be a hospitalist and just thinking of, I just want to treat them and move on. So this kind of gives you a opportunity to utilize different parts of your knowledge base and also trying to think outside the box and understand that there's more than one way to manage things. So it allows you to go into your toolbox a little bit more, challenge yourself. It is a challenging field in regards to taking care of patients without the right tools, but it is very gratifying. So people are interested and definitely look into it, and they can always reach out to us too to get more information.
Yeah, yeah. And anybody listening, I've had very limited experience working in this type of field, just in the marketing thing, but it is super rewarding and super amazing. Dr. Reddy, thank you so much for being on. Where can people learn more about you and where can people learn more about Summit Medical Consultants?
Sure. Yeah. So we're on our website. So they could find us there at summitmedicalconsultants.com, or even find me on LinkedIn. I'm more than happy to increase the educational value for whoever, whatever question it may be. But those are the main two
Awesome.
places.
Cool. Thank you. Thank you again so much for being on.
Awesome. Thank you so much for having me.